Welcome to another eye-opening video from Unbelievable Top 10. Today we're venturing into a topic that is as unsettling as it is relevant to each one of us. Medical mistakes. These aren't just blunders, they are errors that occur more commonly than you'd think, and their consequences can be severe, even fatal. They remind us of the human element in medicine, an element that is prone to error. From the operating table to the hospital bed, these mistakes can turn a routine procedure into a nightmare. Today we delve into 10 horrifying medical mistakes that could happen to you. Prepare yourself, as this might be a bit unsettling. Kicking off our countdown, at number 10 is the horrifying mistake of leaving medical instruments in patients. It may seem like something straight out of a horror movie, but it's a disturbing reality. In the chaos of an operating room, surgical tools such as scalpels, clamps, and even gauze pads have been forgotten inside patients. This alarming oversight can have serious implications. These forgotten items can lead to infection, causing severe discomfort and pain. In some cases, they can even puncture vital organs, leading to potentially life-threatening complications. In most instances, these foreign objects are not discovered until the patient starts experiencing unusual symptoms, leading to further invasive procedures to remove the forgotten tool. The psychological impact of such an event can be just as damaging, eroding trust in medical professionals and causing anxiety around future medical treatments. Imagine walking around with a scalpel inside you, a chilling thought indeed. At number 9, we have the shocking blunder of performing surgeries on the wrong person. Imagine waking up from a surgical procedure only to discover that you've undergone an operation that was never meant for you. This is not a scene from a horror movie, but a real-life nightmare that some unfortunate patients have lived through. In these instances, a mix-up in patient identification or a failure in preoperative verification can lead to such catastrophic errors. The physical toll of an unnecessary surgery is daunting enough, but the psychological impact can be equally, if not more, devastating. Patients may grapple with feelings of violation, mistrust, and fear, forever changing their perception of the medical profession. Such errors highlight the importance of stringent checks and balances in healthcare settings. But despite best practices, these horrifying mistakes continue to occur, albeit rarely. One moment you're in for a routine checkup, the next you're wheeled into surgery, a terrifying thought. At number 8, we delve into the macabre mistake of mistaking a living person for a corpse. This is not a plot from a horror movie, but a real-life medical blunder that has happened more times than one might think. Picture this: a person, seemingly lifeless, is declared dead, only to awaken later, much to the shock and horror of everyone involved. Cases of premature declarations of death are not unheard of, and the ramifications can be emotionally devastating. Consider the turmoil felt by the patient, the sheer terror of being mistakenly pronounced dead. Then, there's the emotional trauma inflicted upon their families, who must grapple with the grief of loss, only to be thrust into relief and confusion when their loved one is revealed to be alive. The medical world strives for accuracy and precision, yet these chilling instances serve as a stark reminder that even the most seasoned professionals can falter. Imagine waking up to find yourself declared dead, a truly spine-chilling scenario. At lucky number 7, we have the deadly mistake of air embolisms. This silent assassin can strike during surgeries when air accidentally enters the bloodstream. The consequences? Well, they can be fatal. An air embolism might sound inconsequential, but it can cause a blockage in the circulatory system, cutting off the blood supply to vital organs. Imagine this: a small bubble of air, no bigger than a grain of sand, can cause a heart attack, stroke, or even death. The immediate effects are often severe, including chest pain, breathlessness, and a sudden drop in blood pressure. But it's not just the here and now that's concerning. Long-term effects can include permanent organ damage, paralysis, and even cognitive impairment. So next time you hear about the perils of surgery, remember, it's not just the scalpel that poses a risk. An unseen bubble of air, a silent killer, terrifying, isn't it? Moving into the top half of our countdown, at number 6, we have blood transfusion errors. Imagine this: you're in dire need of a blood transfusion, your life hanging in the balance. The medical team rushes in, hooking up the transfusion bag, a literal lifeline. But then, a blunder occurs. The wrong blood type is introduced into your system. This isn't just an oops moment, it's a potentially life-threatening error. The immediate effects can be catastrophic. Your immune system, recognizing the foreign blood as an invader, launches a full-scale attack. This can lead to fever, chills, and in severe cases, kidney failure or even death. But the long-term effects, they're no less concerning. Hemolytic reactions, where your body destroys the transfused blood cells, can lead to anemia. And then there's the risk of developing antibodies against the foreign blood type, complicating future transfusions. The very thing meant to save you could end up being a threat, a horrifying prospect. At number 5, we delve into the nightmare of wrong surgeries. Picture this. You're wheeled into the operating room, prepared for a routine appendectomy, but wake up to find out they've removed a kidney instead. Horrifying, isn't it? These cases, while rare, are not unheard of. The aftermath of such a blunder is not just physical, but psychological as well. Patients have reported experiencing severe emotional distress, anxiety, and even post-traumatic stress disorder. They're left questioning the competence of their healthcare providers, and their trust in the medical profession is undeniably shaken. Moreover, the physical implications can be catastrophic. Imagine undergoing an unnecessary invasive procedure, the risks that come with it, and the potential long-term effects on your health. It's enough to send shivers down anyone's spine. Undergoing surgery is scary enough, but the wrong one, that's a whole new level of terror. At number 4, we explore the terrifying reality of misdiagnoses. It's a common scenario, and yet its implications are far from ordinary. Picture this. You go to a healthcare provider suffering from what you think is a common ailment. You trust them to diagnose correctly and provide the right treatment. But what if they don't? What if that persistent cough isn't just a cough, but a sign of something more severe? What if that constant fatigue isn't due to stress, but an underlying chronic disease? The misdiagnosis of common ailments can lead to severe complications and even death. The wrong treatment can exacerbate the actual condition, leading to irreversible damage and sometimes tragically loss of life. It's a chilling thought, isn't it? Imagine suffering from a common ailment, only to be misdiagnosed, a truly terrifying thought. At number 3, we have the dangerous mistake of medication errors. A simple slip of the hand, a moment of distraction, and lives can be changed forever. There are harrowing tales of patients given the incorrect medication or dosage, leading to severe complications or even death. Imagine, instead of receiving a healing compound, you're administered a harmful drug, or perhaps an overzealous dosage of a necessary medication triggers an overdose. These errors can occur at any stage of the medication process, from prescription and dispensing to administration and monitoring. Every step is a potential pitfall, a ticking time bomb, and the consequences? They range from mild discomfort to devastating health complications. And in the worst-case scenario, death. Medication meant to heal, but when wrong, can be lethal. A chilling thought, isn't it? At number 2, we have the horrifying reality of infections from contaminated medical equipment. Picture this. You go into a hospital expecting to be healed, but the very instruments meant to help you turn out to be your worst enemy. Frequent, yet often overlooked. Infections can arise from unsterilized or poorly sterilized medical equipment. These infections can be as minor as a skin rash or as severe as a life-threatening condition. The risk increases manifold when the contamination involves invasive equipment. Think surgical tools, catheters, or needles. These tools, if not properly sterilized, can introduce harmful bacteria directly into your body, bypassing your natural defenses. The result? Infections that can lead to serious health complications, prolonged hospital stays, and in extreme cases, even death. This is not a rare occurrence, unfortunately. Despite stringent sterilization guidelines, lapses do occur, leading to preventable infections. The very tools meant to heal potentially causing harm, a truly horrifying prospect. And finally, at number 1, the most horrifying medical mistake: poor hygiene practices in hospitals. Imagine the very place you go to for healing, becoming a breeding ground for harmful infections due to negligence in maintaining cleanliness. It's a chilling reality that happens more often than we'd like to admit. Infections can be contracted from a variety of sources in hospitals. It could be from contaminated medical equipment, unclean hands of healthcare professionals, or even from the hospital environment itself. These infections can lead to serious health complications, and in some cases can even be fatal. Despite strict guidelines and protocols, lapses in hygiene practices still occur. And it's not just about maintaining physical cleanliness. Proper sterilization of equipment, appropriate disposal of medical waste, and adherence to infection control measures are all crucial. The irony is stark. A place of healing, potentially a place of harm, truly a scary thought. And there we have it. Our countdown of 10 horrifying medical mistakes that could happen to you. From leaving medical instruments in patients to mistaking a living person for a corpse, the world of healthcare can sometimes be a scary place. We've also explored the dangers of air embolisms, blood transfusion errors, and wrong surgeries. Misdiagnoses, medication errors, infections from contaminated equipment, and poor hygiene practices in hospitals also made our list. Awareness of these potential mistakes is crucial to ensuring your safety. Remember, knowledge is power. Stay informed, stay safe. Don't forget to subscribe to Unbelievable Top 10 for more chilling countdowns. Until next time, take care.